why I don't only order TSH for kids.
Hi, I'm Dr. Erika Krumbeck. Welcome to NatPeds Pro, where we break down evidence-based research and whole body approach to pediatric care. This channel is for healthcare providers looking for clear, research-backed insights into treating pediatric patients with confidence. Don't forget to like and subscribe. Let's get started.
So TSH in kids is totally different than TSH in adults. And I really want, especially naturopathic doctors and functional medicine providers, people who are used to talking about ideal reference ranges in adults, they just don't apply to kids really at all. So for adults, I know, especially for things like fertility, when I'm working with fertility patients, we want a TSH ideally between 1.5 and 2.5. And for kids, we just don't see the same sort of reference ranges at all. And part of this is because children are growing. So I think it's really important to understand that, remember that TSH is the brain telling the thyroid gland how much thyroid hormone to make. So for kids, in times of growth, especially in adolescence or pre-adolescence, the brain is trying to tell the thyroid gland to make more thyroid hormone in this time right before rapid growth. So that means the TSH is going to elevate pretty dramatically sometimes. So we'll see a TSH of 4, sometimes 5, although that would, I think, be probably too high. But it's not uncommon to see a normal or even high free T4 and a high TSH. If we're only looking at the TSH, then we might see something like, oh, maybe we have subclinical hypothyroidism, and instead we're just getting the signal from the brain prior to a period of rapid growth. So that's something I feel like is really, really important for providers to understand, that we cannot take ideal reference ranges for adults and apply them to children, especially growing children. So TSH and free T4, I put on almost every normal pediatric lab draw. So I have some labs that I am consistently running for kids. So basically, whenever we get any excuse to order blood work for children, so if we're concerned about something else, I almost always throw in a TSH and free T4 if there's any concern that there might be any abnormal thyroid function. That could even be for things like constipation or growth failure or a whole number of endocrine issues. But that is on a standard lab test that I do. And we should always do a TSH with a free T4 because it makes interpreting that TSH much easier and potentially spare kids from having to do a repeat blood draw when that TSH is high or high normal. We can look at a high or high normal TSH with a perfectly normal free T4 and in most cases say, oh no, this is just a kiddo who's growing through a growth phase or a phase of rapid developmental change. So that's really not concerning at all.